Thanks for joining us for this symposium. I'm Bill Rapisi, President and CEO of the Lymphatic Education Research Network. LE&RN's mission is to fight lymphatic diseases through education, research, and advocacy. In order to win a fight, you first have to join it. So we ask, please become a supporting member of LE&RN at lymphaticnetwork.org. And we hope you enjoy today's symposium.
I'm Sergio Gianesini. I'm a surgeon at the University of Ferrara in Italy, and also an adjunct professor in the Uniform Service University of Health Sciences in Bethesda. I have the honor of serving as the president of the International Union of Phlebology and as emeritus president of the venous-lymphatic International Network Foundation. Particularly today, I have the honor of giving this talk about science per Aquam, dedicated to the evidence-based use of the aquatic environment for our veins and lymphatic patients. I thank LE&RN and the LE&RN supporters, and I report the important disclaimer regarding the appropriate use of this presentation, so not to be confounded with something that can replace, of course, your healthcare provider. While we are diving into the aquatic environment, it's very important to start from the acronym of SPA. SPA comes from the ancient Latin, that is salus per aquam, which means health through water. That's how they were referring to the aquatic environment at the time of the ancient Latins. Now we change this acronym in science rather than just salus per aquam, desiring to highlight in this way the importance of the evidence-based data in an environment that has been quite too much empirical. I have no conflicts of interest to declare, apart from the fact that they won a competitive grant with a foundation dedicated to the investigations in the aquatic environment. And I really want to declare that it is interesting to me how the aquatic environment has always been there. You must consider that at the time of Hippocrates, it was already stated that a way to health is to have an aromatic bath. Now, clearly, this is not evidence-based as a statement, but really gives us an idea of what also the Emperor Augustus showed us at the time of Christ, with 170 aquatic centers just in Rome, and with the tendency to create immediately an aquatic center as soon as the ancient Romans were conquering a land like in the city of Bath in Britain. Now, with a jump in time in 2022, we see that 101 million visitors just in the USA are going to the aquatic environment, for a total of 21,840 aquatic centers that might present an extreme heterogeneity in the quality of the aquatic service they are providing for our veins and lymphatic patients. This is a constantly growing market with a lot of people and a lot of business involved, for which is very important that we as scientific societies and experts make sure that what is proposed to our patient is in line with the scientific data. Because indeed, going to the spa is surely pleasant, as you can see from the Global Spa Wellness Summit, a significant amount of money are invested in this environment, but it's very important we don't just enjoy that like three labradoodles diving into some water. We have so many of these centers, in particular in Italy, of hot and cold water with no real validation, for which it's very important we go back in time analyzing what we have in terms of science on this topic. At the time of the cassette, Ernst already did a very good job reporting that by a not standardized walk in hot and cold water, there was a potential improvement in terms of some subjective symptoms, ankle circumference, and leg volume. Here you can see the original investigation that is, of course, of great interest. At the same time, the issue is that we are not really having evidence-based data in the terms of standardization and reproducibility, because they were just doing different kinds of walking inside the cold and hot water. Standardization, again, and reproducibility are the two key words for this kind of investigations. The same thing happened a few years later with Carpentier, who is a great colleague who did great investigations on the topic, even with a crossover in advanced stages of chronic venous disease with an impairment also, of course, of the lymphatic system. What he was demonstrating is that there is indeed a benefit in the aquatic environment, but at the same time, this benefit demonstrated the crossover, so inside rather than outside the aquatic environment, was associated with not standardized protocol, because indeed, even if there was an improvement in the pain, in the patient's reported outcome, in the quality of life for this patient, and even in the pigmentation index, so the deposition of catabolites of iron in the leg, and also the healthiness of the skin through the erythema index, that was indeed improved. The standardization and reproducibility was lacking because the type of balneotherapy, as you can read quote unquote from the paper, was chosen by the spa physician for each and every patient, which means, of course, no standardization. Same thing happened 5 years later in another investigation where they were looking again possibility of treating advanced cases of venous and lymphatic impairment, in particular with ulcer patient, with actually no difference in terms of ulcer incidence, but an improvement in terms of quality of life and the patient's reported outcome. But again, the type of balneotherapy was chosen by the spa physician for each and every patient, which means no standardization. Now, in the aquatic environment, we have a great advantage, that is the one of physics, and in particular the Stebbins law, which is stating that the hydrostatic column is basically associated with the pressure we can create, because the hydrostatic pressure in a graduated way really depends by the height of the hydrostatic column, because the other two are constant, not variables, which is indeed the gravitational constant and the density. Every single centimeter of water is equivalent to 0.74 milliliter of mercury, which means that when we are into the aquatic environment with the water up to our navel, we are around 88 millimeters of mercury, which means more than 4 pairs of usual stockings. Moreover, the aquatic environment is magic because the Laplace law is not perceived. So the different vectors of the forces acting on the surface of the skin are always perpendicular with no variations, for which we have an homogeneous massage of all the leg with the related graduated compression. In the aquatic environment, we have different potential benefits that are moving from the temperature to the chemicals to the physics of property. Now, in terms of physical exercise, we know it's very important to activate the calf pump and the legs in general. Unfortunately, also on dry land, we have not that many standardized protocols we can use. Absolutely no in the aquatic environment available protocols up to our knowledge until we started investigating on this topic. For which we published in 2017 a first paper that was indeed assessing a protocol of exercise we standardized, looking at the leg volume, ankle range of motion, symptomatology, and walking ability after 5 sessions, 2 sessions per week, 15 minutes each, on 32 lower limbs of patients affected by phlebo-lymphedema. The protocol is standardized and deposited in the University of Ferrara, for which we remain at your disposal as Science per Aquam for collaborating in its use at best. That is indeed the best solution, very probably, for our patients affected by lymphedema in terms of physical exercise, because indeed after these 5 sessions, we have a significant decrease in the lower limb volume, as you can see, more than 300 mils. We have a significant decrease in the subcutaneous thickness and also in the leg circumferences. And we have an improvement in the dorsiflexion and plantar flexion. And that's why you see Michael Jackson there with his moonwalk, walking backward, because indeed he's activating more the dorsiflexion, the range of motion of the ankle, according to a previous paper by Dixie, that was actually then related to the lower limb volume decrease in our investigation. This is important because in reality, the improvement is very minimal in terms of grades, but still significant. So if you talk with an expert of ankle range of motion, you will see that there is no big variation, but in reality, that variation is statistically significant and sufficient to create better control of the edema. In terms of lower limb heaviness, there was a significant decrease from 7.3 to 5.5 at the visual element scale. And if you want, we can talk during the discussion about why the functional ambulation classification, that is a validated score basically to assess how a patient is walking, did not improve. This is the first paper then that you can find in the Science for Aquam investigation. It's a very easy one, I would say, but very important because it's moving from empiricism toward evidence-based science with the demonstration that we can indeed reduce the lower limb volume, improve the ankle range of motions, control the symptoms. We cannot change the walking ability. And again, the main outcome, I would say, of this investigation is the fact that we are moving from empirical knowledge toward evidence-based science. That is nothing new, though, because indeed this investigation is following what we already know, that the stockings actually are coming from the aquatic environment, because indeed we know the story about the engineer who was affected by an ulcer, then diving into the aquatic environment. He noticed that the ulcer was healing, and he understood that the graduated compression of the water was involved. But indeed, you could ask me at this point if it is the aquatic environment or if it is the exercise giving this benefit. And that's why we designed an important randomized comparative trial, the data study that is now published on Journal of Vascular Surgery, where you can notice the different activities that we produce in the aquatic environment following the protocol, reporting indeed that there is an improvement in the lower limb volume in the aquatic environment, not outside the aquatic environment when we are doing the same exercise. In terms of subcutaneous thickness, again, an improvement in the aquatic environment rather than outside the aquatic environment, as you can see in the different point assessed at A, B, C in the image. The caliber of the great saphenous vein was significantly decreased just in the aquatic environment, not outside the aquatic environment during the same protocol of exercise. This is not a really important data, I would say, because this is not really telling us much, because it really depends on where we are in the different compartments of the leg, superficial, deep, or interfascial compartment. But still, it gives an idea that the saphenous compartment, there is not an overload during the aquatic environment exercise, rather actually a decrease. The ankle range of motion improved in both groups, both inside and outside the aquatic environment. But if you compare the two groups, there was a better improvement inside the aquatic environment. And indeed, only inside the aquatic environment, there was a correlation between the ankle range of motion and the lower limb volume. The quality of life measured by a disease-specific score, that is a CIVIC, improved in both groups, while another disease-specific quality of life score, that is VVMCQ, improved just in the aquatic environment. That is reminding us the importance of always assessing the quality of life by means of two different scores at least, because we can find differences. Now, this investigation of ours, like this randomized comparative trial, has been reported with the lowest risk of bias in the recent review on the topic, and as the only randomized comparative trial available on this topic, for which I really like to thank all the team workers who co-worked with us in this publication. At the same time, I'd like to thank all the ones who co-worked with us in Science for Aquam for publication of the bioimpedance data related to the immersion in the aquatic environment, demonstrating that indeed we have an extracellular fluid shift that is correlating with the lower limb volume decrease. This is in line with the previous decrease and the related association of lower limb volume and ankle range of motion in the previous publication. Another very important publication, I think, is the one in which we demonstrated that the fitness performance of the people doing this protocol is improving in terms of blood pressure, in terms of heart rate, so that we are actually killing more than two birds with one single stone in the aquatic environment. That's why we included this topic already back in 2019 in the guidelines analysis we have done during the winter 2018 meeting, pointing out the importance of the aquatic environment for the different venous and lymphatic patients. We know how compression is important Consider that if, for example, you had an ulceration and then you don't use compression after you heal from the ulcer, you have 9 times the risk of having a recurrence. So the aquatic environment can help us a lot in terms of both early and also very advanced stages. In terms of ulcer reading, in terms in particular of pressure ulcer reading, there is very limited data for the use of the aquatic environment. There is just some preliminary data showcasing that there is a potential benefit. While when we are talking about arterial patients, we see that there is, again, some preliminary data suggesting an improvement in clavicle patients, but we need more data to really dive into this topic. The reason why I'm talking now about arteries together with veins and lymphatics is that very often our patients are presenting also an arterial component that might benefit from a lymphatic and vein improvement. You see over here, for example, that signs of chronic venous insufficiency were reported in 21% of patients with peripheral arterial disease, only in 18% of cases traced. I really suggest to have a look also at the lymphatic conditions of these patients, because clearly also for them, very probably there is some lymphatic issue to take care of. So going toward the conclusion, the aquatic environment is offering us many benefits, not just in terms of physics property, but also in terms of thermal and in terms of chemical properties, for which we are investigating also these aspects now. A big topic for discussion, if we like, is the one of the temperature, because indeed, I know there are 2 different lines of thinking on the topic. It's also true that the blood is 37 degrees per Celsius, so the fact that we cannot really go too high in temperature is really questionable sometimes. Of course, we don't have to exaggerate, but there are interesting papers like this one showing us that if we increase the cross-sectional area of our vessels and we pump in them, we have the possibility of actually improving the venous flow and potentially, I think, also the lymphatic flow. We have also interesting preliminary data suggesting us that hydrogen sulfide can help us in preventing platelet aggregation, which means potential also benefits for the lymphatic system as well. And this is in line with previous investigations of our group looking at the biomarkers of inflammation when we are restoring the venous system. I would be very curious to see the impact of these biomarkers of inflammation on the lymphatic system, for which future investigation should be addressed on this also after the aquatic activity. In conclusion, clearly, we have so many different actors involved in the management of our patients, and also the doctors involved in the aquatic environment should be included in this group, because really they can help us a lot. Managing in a holistic way our patient, because if you have a flooded floor, so a venous and or lymphatic issue, for sure you want to also look up. It's very significant for me that we have a significant percentage of patients with chronic venous disease affected also by hemorrhoidal disease, which means, of course, talking with the proctologist, but also we have 10% of our patients presenting with varicosities that are actually having pelvic leaking point, for which it's very important to talk also about the potential benefit of the aquatic environment for the control of the pelvic reflexes that very probably are associated with an impairment of the lymphatic system as well. In this sense, we are talking about 1 woman out of 3 for pelvic pain, and one of the main causes of pelvic pain can indeed be this reflux in the pelvic region. That is, by the way, most frequent than asthma and back pain per se, for which I really encourage you as lymphatic experts to also consider the sources of venous hypertension at the lower abdomen. And it's always about gravity, of course, and that's why we don't have varicose veins on our upper limbs, rather on the lower limbs. That's why we are so focused in able to promote the vein week, that is the vein dedicated, this week dedicated to vein awareness, that I propose to melt together with the March, in particular 6 lymphedema days, so that by March and April, we always celebrate the awareness of both veins and lymphatics. There usually is a question about why our dogs don't have varicosities, because of course we are bipeds and they are quadrupeds, but then the real question would be why the giraffes don't have varicosities or lymphedema, considering how tall they are. And this is because of their skin, as we know, because it's like a natural stocking. And that's why I think it's very important to annoy you a little bit diving into the topic of how frequent this condition is, because it's like flipping a coin. One patient out of two, whatever specialist that we are, is going to have a venous and or lymphatic issue. If you're talking about aesthetic concerns in the venous system, this means more than 80% of the population that is actually presenting something underneath in terms of venous and lymphatic drainage impairment in up to 26% of cases. This is also a moral call to act, because this is a huge cost for our healthcare system that is surely not in the desire of keep on having 2% of the population with ulcerations that clearly are including a vein and also lymphatic component. This is a call to action because at the same time, we keep on having this issue of centrism that is increasing in our population. So clearly this goes with the title that is reminding us that we are all aging, we are all becoming more obese, we are all becoming more sedentary, and indeed the venous procedures that keep on growing in terms of numbers. And the mistake we can do is just treating the veins without considering the lymphatics and the potential benefits we have in the lifestyle that eventually can include also the aquatic environment, particularly also for those healthy subjects that over 50 years old are presenting an edema that can create a vicious circle that really is our task to stop. And this is another category, I would say, to take into consideration for aquatic activity. Because it has been demonstrated that if we work in a place where we are prolonged sitting or standing, even our thrombotic risk is increased. So for sure, also the lymphatic one. As you can see, varicosities can be associated with an increased risk of thrombosis, but also of peripheral arterial disease. This means that whenever we have a venous impairment, we have also an endothelial impairment that is affecting also the arterial system, and it's very difficult to think that we are not going to have an inflammation also of the lymphatic part. This means having an increased risk of thrombosis, and I really wonder if we shouldn't stress out more the potential thrombotic risk of the lymphedema patients. That's a topic we will include in our next global event in October in the Bali Island, where you're all invited as LE&RN group to join. It will be our honor to have with us the same Professor Roxon, who is our light in the lymphatic system, as the light over here that is actually reminding us of the importance of the leading cause of preventable death, that is thrombosis, for which another light we have in the thrombotic field in this case is Professor Caprini, with whom we even created an app that I invite you to download, because it is allowing you to calculate the thrombotic risk together with many other risks of your patients and patients' reported outcome and scores, even before you visit your patients, so you can collect a lot of data to be extremely prepared to visit it. This is important because many times we are not considering, for example, the thrombotic risk that, look at here, 3% of the women are actually having when they're going to the gynecologist for whatever reason. Interesting study that is showing, again, 3% of incidental uterine venous plexus thrombosis in asymptomatic patients going to the gynecologist for whatever reason. I really think that the lymphatic component around this thrombosed veins might be involved as well, and can eventually take part in the hidden epidemic of the lymphedema, for which, again, the topic of today of the aquatic environment can become of extreme importance, as it is of extreme importance having not just the natural compression of water, but also the physical compression of validated stockings that I underline must be validated. These are two very dear friends of mine who are flying, forgetting their stockings or buying at the airport, and too many times not finding certified products. As clearly we should fight not certified products as topical, that I'm sure you have also in the lymphatic field, like this one for the vein that is making the vein disappearing according to the claim, clearly not representing evidence-based data, rather fake news that are shared 450,000 times, starting from 40% of the medical website, according to PubMed, for which it's really our responsibility to counteract inappropriate management of our patients. In Italy, for example, the government is covering just for 12 sessions in the aquatic environment, which really makes no sense, in my opinion, considering the chronicity of the condition, for which maybe we should advocate more of this topic, as we have been doing during the institutional event at the Universal Expo last 2022 and 23, publishing 100 pages for the experts and summing them up in 12 different pages booklet in layman terms for our patients, including also this topic, including lymphedema, for which you're all invited to have a look at the Viewing Foundation website, where you can also report eventually encountered misinformation, and you can eventually also ask about validity or not of different healthcare suggestions. Science per Aquam is available now wherever in the world, and of course, if you want to join, we are very happy to collaborate. We have training centers in Italy and in Abu Dhabi, and whoever is interested in creating training centers, we are at disposal. Another one will be created in Indonesia following our presence there for the October World Congress. We will actually welcome everybody with a session by the pool, in actually the pool where the training on the Science per Aquam protocols. You're all invited, and we really look forward for sharing also a humanitarian moment of 2 days pre-Congress, where we will treat a lot of veins and lymphatic patients, and of course later on the institutional event that will be indeed in beautiful Bali Island. As president of the World Society of Phlebology, like that is the International Union of Phlebology, I remain also at your disposal for whatever needed, in particular for whatever collaboration we'd like to build together. And I take this chance to deeply thank once again Professor Roxon for the inspiration he represents to all of us, and at the same time LE&RN for being an outstanding organization with whom I really look forward for working more and more. Thank you so much. With this, I know I am on my own, so I will moderate myself. So we have, I may have missed it, but what water temperature is best, please, in Fahrenheit? Suzanne, that's actually 32 degrees Celsius, so please make your calculation, because despite I'm often in the US, I have serious issues in converting in Fahrenheit. However, it's 32 degrees Celsius. This is a brilliant question, because indeed, when we are talking about the aquatic environment, we are basically having 3 different possible actions. One is the one of chemical powers of the aquatic environment. Still, we have to put evidence on this. Another one is the one indeed of the temperature. Up to my knowledge, still not that much evidence on that. Indeed, we are collecting data at different temperatures. And the other one, of course, is the physics property of the aquatic hydrostatic column. What I can tell you is that, of course, there are different opinions on this. In terms of the vein drainage, even if it is a little bit hotter, it's not a big issue as long as you activate the cuff pump. There is preliminary literature that is showing that if you increase the cross-sectional area of the vessel and you pump, you will have more flow. At the same time, when we're talking about the lymphatic patients, we have to be extremely cautious. Talking also with other colleagues, experts in lymphatics, this remains an unmet need. There are some who are really discouraging hot temperature, others who are claiming that our blood is already at 37 degrees. So maybe it doesn't make that much a difference. Again, in Science per Aquam, we always try to have evidence-based data before talking. So what I can tell you is that the evidence-based data now is at 32 degrees with no issue at all, actually benefit. Empirically, we can eventually push that a bit higher, but this is open for discussion. Then we have how does the effect of aquatic exercise compare with doing exercise while wearing properly fitted compression stockings? Very nice question by Anna Towers. Thank you, Anna. We have done quite a lot of investigation with the use of compression stockings in physical activity. You can PubMed me, and you will find that we checked in standardized walking with and without. We did that also in other kind of intermittent walking in healthy subjects and also in non-healthy subjects. We don't have a direct comparison. I would say that the lower limb variations that we had in the aquatic environment was significantly higher than compared to the one of graduated compression stockings. Of course, aquatic environment is not a substitute of graduated compression. Actually, it is a great friend. Also in terms of compliance. So what I can tell you is that once my patients experience the aquatic environment benefit and they understand that indeed stockings are coming from the aquatic environment, because we all know the story of the engineer who was affected by an ulcer and diving into the pool understood that the hydrostatic pressure was helpful for him, for which he recreated the same graduated compression of the water in the stockings. Well, back to us, I would say that in between the sessions, having a compression stockings really helps you a lot maintaining the results, because what we notice is that after one session, you have a decrease of more or less 100 mils, but then after those 3 days, you're almost losing all the edema control. You just have a 20% residual benefit after 3 days, 3-4 days. That's why we really recommend to have it twice a week, this kind of activity in the aquatic environment. And of course, with compression in between, you can absolutely maximize the results. So I wouldn't use one or the other. I would absolutely recommend to use both. Then we see Margot is writing, has any research been done regarding how muscle constrict the lymphatic system from operating correctly? My work shows a direct correlation, but I'm not a medical professional. That's a very interesting question that I think should really be dissected into the specific compartments of the different muscles. We are now impressed with an investigation we have done with an interesting prototype of leg press that is allowing you to do 3 different muscular activities. One is isokinetic, basically. Another one is viscoelastic, as it is called, and one is with progression of the weight on it. And we have seen a real difference when you are activating agonist and antagonist muscles of the different compartments. So I'm not aware of any investigation that is specifically addressing one muscular group. Getting all of them together, I think it's quite a lot of confounding factors. There are some very interesting investigations, though, regarding how compression can help managing the performance and the perceived tiredness of the muscle, and also the electromyography. So, of course, the things goes together, and we all know the importance of the muscle mass. So I encourage you, Margot, to publish your data so that we can have a better look. And Margot is still writing, I would love to collaborate, including a willingness to travel in any way possible. I started this video later than I wished, and I would love to share experiences I have with medical conditions by accessing and stimulating a deeper lymphatic system, which is not commonly done. If this might be possible, I would like to know. Of course, we'll have a lot of interaction during the World Congress in Indonesia. We will also have dedicated aquatic sessions live, and I really welcome you, Margot, also in presenting your work if you want. And Suzanne is writing, thank you very much for this talk. Could you talk specifically about what types of movement and length of time in water was most beneficial? So the protocol at the end is quite elaborate. So really, there are different parts. Basically, you have an activation, as I said before, of all the joints. We've done this together with physiatry, and is including also forward, but also backward and lateral walking. The backward is particularly important for the activation of the ankle range of motion, for which, for example, in Italy, there is still the bad suggestion of just going walking on the water, in the water, sorry, by the seashore, and with the water just up to your knees, which makes no sense because you really want to have a deeper water so that you can exert the hydrostatic pressure. Another thing that I really discourage is to have those walking paths with cobblestones or such, because then the foot is not really putting down in the proper way. And we know that at least 20% of the venous return is from the foot, which means that we really have to maximize the weight bearing of these subjects and the correct posture, for which I usually suggest not to use this kind of surface. Then we have, are there specific aquatic exercise? Does floating in water have a benefit? So are there specific aquatic exercises? Absolutely, yes. The protocol I described, and floating in water have a benefit. Well, floating, that's a very interesting comment, because in reality, of course, swimming is good for your cardio fitness in general health, I would say. But in terms of stimulation of the venous return, you're just lying flat. So in terms of pumping action, of course, it's good that you're activating your pump while you are like a zero pressure, but it's a little bit different than using the hydrostatic pressure that is huge if you think about that you have in depth water, meaning that in deep water, I mean, because if you really think about that, as I said, 80 millimeter mercury are a lot, and you cannot even feel them. That's very cool. And that's because, as I said, Laplace law is not working in the depth of the water, which means that you have the vector of the forces acting always perfectly perpendicular to the surface, so you don't feel that pressure. And that's the real magic, I think, for both the veins and the lymphatics, enjoying this pressure without even feeling that, for which also the compliance, of course, becomes very good. In this sense, a comment, I think, is the one of the density. If you really make the calculation, even if you increase the density, like high density water, like, I don't know, the Dead Sea water, you are not going to have a significant increase in millimeter mercury, which means that, yes, you might have a mild benefit because you have a hyper dense water, but not in terms of millimeter mercury, very probably because you have other salts inside that are acting chemically. It's also true that tonight, when you will go home and you maybe had a sock with an elastic band, the elastic band, if it is not a certified stocking, is just 5-8 millimeter mercury, and still it leaves a dent, which means that still you have some pressure there that is able to control the edema. We know that there are two main actions in compression. One is the edema control, the other one is the one of the hemodynamic effect. The second one goes more with the stiffness of the product, and the edema control is more for the millimeter mercury. You don't need that many millimeter mercury. Then, we have Kathleen Liss, and I really like to see her here, and I really thank her for all she's doing to bring our world together. How soon after venous surgery are patients allowed to return to the aquatic environment? I would say immediately, Kathleen. We are doing now pinhole procedures. So for me, they can go directly into the aquatic environment because the only eventual minimum access they have is by the thigh when we are doing endovenous procedure, or the rest is by injections. So for me, they can go immediately. It's very important to have, of course, clean wounds. But really, we visit and actually have a pool in the center. So absolutely immediately. Yvonne, Editor Gianesini, my name is Yvonne. I'm from Brazil. I want to know if you are planning to come here. Yeah, I'm in Brazil quite often. So absolutely, my contacts are available. You just Google my name and feel free to write me. And I look forward for being together in Brazil. I have like a sister for me, like a top figure in our vein world, Natalia Cardoso. Do you do any studies of this protocol also helping on improving symptoms in lymphedema? That's a brilliant question. Now, we have not done lymphedema investigations yet. We really look forward for doing that. I think we have to go one step at a time, because the problem is when we want to achieve too many things in a short time. So it's very important we dissect the water, first of all, in the 3 different properties of chemical, thermal, and physical properties, and then look at the different population. Now, lipedema, it's very important for me to identify, first of all, objective outcome measures to have a real data discussion, meaning that, for example, we know that it's not that much the same edema we are going to have with the lymphedema patients. We know that there are like many confounding factors in lipedema, for which I think it's very important to look at these patients empirically. I have no doubts it's working because I use it. At the same time, I'd like to have a proper data collection before answering to this. And then we have Sue, who is writing, can walking in the pool striking your foot help with osteoporosis? So I'm sorry, I have no background to really discuss about osteoporosis, so I don't want to jump into a territory that is not my specialty. Well, I would say that, of course, at least the reinforcement of the muscle mass, so the stability of the musculoskeletal system you can get by doing the exercise in the aquatic environment can be of help. But again, I have no data, so I really don't want to comment on this, and encourage whoever is dealing with osteoporosis to collaborate with us. Science for Aquam is open to many different collaborations. So please feel free to reach out. We will be happy to co-work together. You remember that I mentioned that the functional ambulation classification was not really changing in these patients. That's impressed us a little bit because in reality, the proprioception empirically is improving a lot, particularly of the more fragile patients, because they're getting more used to physical exercise in the aquatic environment that they could not do outside the aquatic environment. For this reason, I think there might be a benefit also in the osteoporosis because of the strengthening of the muscular component. But again, let's talk with the experts for this. Then we have Margot, who is writing, I've done lots of work over the last 13 years and already can correlate many parts of the body are affected by blockages within the lymphatic system. I'm approaching 70 and feel a strong commitment to see this information reaches the medical research community. I've published a medical article already. I've noted your email address. Mine is, I noted while working on a friend client that the ability to correct the lymphatic system in warm water was far superior to on a simple table. When I did get into a presentation, I was delighted you were correlating areas to the lymphatic system. The areas, for example, for kidney problems are different than for asthma allergies. I will email your additional information and hope to have the pleasure of crossing paths with you. It will be my passion, Marco, to collaborate with you. Very happy to do that and to see your enthusiasm on this. Very happy to see that you're mentioning the hot water or warm water, because we might have a preconcept there. At the same time, we have to be extremely cautious because we don't have solid data. So I would not encourage, of course, lymphatic patients to go in hot water. But at the same time, we don't have to consider that pure evil, because we might have a benefit with a proper temperature in a little bit of a vasodilation that is helping a little bit of the blocked part to drain better. But the typical example is in a preliminary data collection we have done in the sauna, where while sitting, the patient was showing air plethysmographic parameters that were horrible, pretty dangerous. So air plethysmography is basically an objective measurement of the drainage. But while the patient was lying down with the legs up, the drainage was absolutely improved compared to normal. So again, it really depends on how you practice these activities. With knowledge, it's a little bit like sport. That is the most powerful drug that can be beneficial or harmful based on how we practice and what we practice. A sport per se really can be beneficial if with a specific activity, or very, very harmful, as we know. And indeed, actually, athletes have more thrombosis, by the way. So it would be interesting to see the impact of the different sports on the lymphatic drainage. I was just discussing with Natalia, who is going to have a phenomenal vein week in Brazil. I really encourage all of you to follow her on the social networks for all she's doing in the veins and the lymphatic field. For example, yoga might be extremely beneficial for the drainage, in my opinion, because of the respiratory pump, because of some positions. But some other positions are a bit of concern for me, because when you are like putting the leg in a natural position, I wonder if this is hampering the drainage or not. So it's very important we always interact also with the yoga instructors to make sure maybe we have some vein and lymphatic approved yoga exercises. Fenton is writing, do you use salt water pools or chlorinated pools? Is there a type of salt that may be beneficial for skin and buoyancy? Thank you. Fenton, very brilliant question. We tried both salt and chlorinated. Of course, bigger benefit in terms of edema, but not directly correlated to the increase in millimeter of mercury because of the higher density. And in terms of anti-inflammatory effect, if we want to consider anti-inflammatory effect, the fact that the symptoms were improved, there is a better benefit in salty water, but also normal water, not salt water, is absolutely fine. We reduced in salt water to 30 minutes rather than 50 because it can be more tiring, the exercise in salty water. So for this reason, I would suggest to stay with our protocols in the 30 minutes if you're in salty water. We never perform a study checking out the different salt water. That's something we have in our roadmap. But again, we want to go one by one on the different aspects we consider priorities. There are some preliminary data that are showing that some sulfonylic groups can help. in thrombolytic properties, but this is just lab data. So maybe in the future we will have some special water in this sense, but up to now, no. In terms of skin, yes, there might be some significant benefits up to my knowledge, but again, this is dermatology compartment. I don't want to get in what is not my specialty, but yes, in Italy we use specific waters for the dermatological component. And then any difference in using a large standard pool versus the smaller exercise pool? Absolutely not. This protocol was designed on purpose to allow the patient to move in a limited area. So that's something you can do really wherever. Is there a resource page with the links to read the various published studies you mentioned? Yes, science.aquam.com. So you can find everything there. And you can find also the different activities we are going to do, including the next event in Bali Island, where, of course, there's a lot of water per se. Yvonne, so is it imperative to see an angiologist to see if there is a need for any venous procedure to improve lymphatic drainage? Yvonne, very interesting question. So I think it is very important not to have just a vein or lymphatic consult. Whenever you are dealing with an issue of your lower limb, in terms of drainage, you really want to be in front of somebody who knows both veins and lymphatics, and potentially also, of course, the arterial part. So in this sense, I wouldn't say that it is necessary to see a vein specialist every time you have a lymphatic issue, but it is imperative to have somebody who knows about veins and lymphatics at the same time. The problem is more on our side, I would say, as vein experts, when we don't have the knowledge of the lymphatic part, for which we consider our job done when we remove a vein. And very probably by removing that vein, we are hampering the lymphatic drainage. And that's why I really focus in my practice to have a hemodynamic approach, for which I try not to remove the veins, or rather fixing the drainage by closing the leaking points, and with special care on the lymphatic system as well. With this, I think we are done with all the questions. So I will just have a quick look at the chat in case somebody got wrong. And again, if you want to add something in the question and answer, meanwhile, we have still 5 minutes. And I see no other significant question. Natalia, you actually put another question. Do you think we could have a similar, some benefits or result without using thermal water? For example, in some regions, the thermal pools are harder to find than regular ones. Absolutely, you don't need thermal water. Thermal water is a sort of super water, I would say. So, but absolutely, the normal pool of your town is more than fine. And it's actually a great chance to increase public awareness. That's why we really invite everybody to become part of Science per Aquam, so that you can approach these pools that too often, for example, are proposing, for example, hydrobike. I really don't like that much, because hydrobike is activating the thigh and not that much the calf. And the thigh is really minimal in terms of the push for the venous and lymphatic drainage. So rather than going on a bike, potentially also in a position in which you are leaning forward, for which you are a little bit compressing on the iliac district, for which you reduce the drainage, is not like as good as just enjoying standing up or walking around in a normal pool. Sossi is writing in the chat, is there a significant difference in the result between just aqua and aqua with exercise? Very interesting question, Sossi. In reality, yes. If you look at the data, you will have a greater benefit activating the calf pump. But still, just standing up still, you have the benefit of using basically 80 millimeter mercury of compression that is, in this case, perfectly wrapping the leg. I thank the technical team who wrote that 32 degrees Celsius is 89.6 Fahrenheit, roughly 90 degrees. And with this, I think there are no other comments or questions. So I take this chance to deeply thank the technical team. It has been a true pleasure. Feel free to reach out to my contacts, mail, phone, everything is available online. And if you want to join us in Bali Island. We will be more than happy to have a dedicated learn activity to learn together how to manage it best, and not just the lymphatics, but also veins and vice versa. Thank you so much. Have a nice rest of the day. Ciao.